Welcome back. I am with my friend and colleague, the one and only Jeff Johnson. Jeff is our Senior Account Manager for all things health insurance at Lourie Life Health. Jeff, what we want to do today is just have a conversation about some of the mistakes people need to avoid when buying health insurance, okay? Talk to us a little bit about when you're helping somebody enroll in a health insurance plan, what are some of the things you want to help them avoid?
We want to help them avoid getting the wrong plan, meaning that you got to make sure their doctors and providers are in the network. You got to make sure their medications are covered.
Okay, so when you talk about doctors and providers, so with most of the health insurance plans, if they try to use a plan with a non-network provider, can they still get coverage?
No, unfortunately, with the individual plans, there's no out-of-network coverage at all.
Okay, and then you talk about prescription drugs. That's real important. And what do you do to make sure that those drugs are covered by their plan?
First thing I do is ask if they're on any medications. Are they generic, or do they have to take brand or specialty drugs?
Okay.
Then I recommend them giving me the names with the correct spelling so I can do a formulary search. And a formulary search is a search that we do to make sure that their medications will be covered by a copay.
And a formulary is what we call a list of all covered drugs.
Correct.
All right, next question, Jeff. When they're looking at the plan, these things called deductibles and maximum out of pocket, do they really matter?
Absolutely.
Okay.
Absolutely.
In what way?
You need to understand that before any medical coverage is going to be paid for by the carrier, you have to meet a deductible.
Right.
You may have a copay to get you to see a doctor, but you have to reach a deductible before you start feeling the insurance working.
Okay.
And once you reach that deductible, you'll have co-insurance. Co-insurance is additional costs that you pay until you hit your maximum out of pocket.
Gotcha. So I would imagine when you're talking to our clients, you're helping them understand, where a low deductible or a high deductible might apply for their own personal situation.
Absolutely. If you consider a high deductible plan and that someone's not very healthy, they may be paying less in premium, but in the long run, they may be spending more money out of pocket because of those higher deductibles.
Great, Jeff. All good information. Let me ask you another question. A lot of times people look at health insurance and all they look at is the premium, or we might say the price. What is the monthly cost to enroll in a plan? Should they be looking at more than that?
They should be comparing the price compared to how much they're going to be spending out of pocket before anything's covered.
Okay.
So necessarily, if you're paying the cheapest price for a plan, that's most likely going to cost you more in claims to reach that high deductible before anything's paid for.
Doesn't it really just get back to making sure that we're working with our clients to find the plan that suits their individual needs?
Absolutely. Everybody's different. You want to find something that's affordable, but also something that's going to work for you on your behalf.
Right. Someone who goes to the doctor a lot might need a different type plan than someone that just goes and gets an annual checkup and is never sick.
That's correct. Absolutely.
Good.
Yep.
All right. Jeff, enrollment periods, because things changed a lot with the passage of the Affordable Care Act 10 plus years ago. Let's talk about the enrollment periods. Can you enroll in health insurance anytime?
The only time you can enroll in health insurance without losing coverage or loss of coverage is November 1st through January 15th.
Okay, all right.
If you have your husband's or your spouse's coverage and you get a divorce, that gives you a special enrollment period. So you have 60 days to choose your own plan.
Okay.
It's very important because people call all the time wanting to get insurance that haven't lost coverage and they miss that open enrollment window. There's not much we can do about getting a major medical.
Sure, so if you have a life-changing event, like you lose coverage through a divorce, lose coverage through a job,
yes,
right? Or you move to our state from another state and your state's plan obviously is not network anymore. In all those cases, the magic number is how many days?
60 days.
Okay, great. Jeff, last question for you. 85-90% of the consumers in South Carolina go through the marketplace, healthcare.gov, to get their insurance because they get a subsidy. How important is it to project your income correctly when getting a subsidy?
100% of the subsidy is based on income and household members in the house.
Okay.
If you incorrectly guesstimate or estimate your annual income, you're going to pay back additional tax credits that you received.
Okay, so if you try to underestimate your income for the purpose of getting a larger tax credit, you'll get that credit, but you're going to pay it back come tax time.
That's correct. You're either going to pay before or after.
Right.
So it's best to have the correct income as close as you think, so we can adjust that accordingly throughout the year. So if you have an increase or you withdraw from a 401k, it's important to adjust that income throughout the year so you don't get hit with that large tax credit.
And is that something that we do here at Lourie Life and Health?
Absolutely.
Every day, right?
Every day.
Jeff Johnson, thanks for joining us.
Thank you.
Join us for our next session. Thank you.